Welcome to everyone in this session, in the third session of the Quantum Project about trust, privacy, and the European Health Data Space, or short, the EHDS. We want to talk today about the ethical, legal side of health data. I'm Birgit Bauer. I'm digital health and data expert. I'm also a patient expert, and I'm the coordinator of Data Saves Lives Germany. Next slide. The table of content today is, we are in the middle of welcome and introduction. We will have a great speech from Professor Martinez, and I will introduce the speakers in a few seconds about the EHDS and legal protections, also addressing ethical and legal concerns. And of course, we will have our great discussion as always. And at the end, we will wrap up and give you some final reflections. Please be aware the meeting will be recorded, so you can find the recording afterwards, and also we will share it with you. And please be aware, usually we do a group photo at the end of the session, but we have decided to make some photo shoots during the session. So if you don't want to be photographed or so, please keep your screen dark. So now let me come to our speakers and I will introduce them in a row now. Then you have a short overview what great experts we have today here in the session. And let me start with our first speaker. It's Ricard Martinez. And it's a great honor to introduce such a distinguished legal scholar and thought leader in digital rights. Ricard holds a PhD in law from the University of Valencia, where he currently serves as a lecturer and director of the chair for privacy and digital transformation. His work centers on the fundamental right to data protection and the legal ethical implications of emerging technologies. Ricard has played a key role in shaping national digital policy, serving as one of the 5 rapporteurs for Spain's digital rights charter within the Secretary of State for the Digitalization and AI. Today, his research focuses on regulatory conditions for building trustworthy health data repositories for research and ensuring compliance in the field of AI. He has contributed to numerous EU projects and was awarded the Proactivity and Good Practices Award by the Spanish Data Protection Agency. So welcome to Ricard. In the second, we have Professor Dr. Irit Nachtigall in our discussion. And it's a true pleasure to welcome a leader at the forefront of infectious diseases and research and digital innovation of medicine. Since June 2024, I guess, Irit Nachtigall has headed the Department of Translational Research, Teaching and Cooperation at Vivantes. In parallel, she holds a W3 professorship in infectious diseases and infection prevention at the Medical School Berlin. With a background as an anesthetist and intensive care physician at the Charitè in Berlin, and later senior roles in hospital, hygiene, antibiotic stewardship at Helios Kliniken, Professor Nachtigall brings deep clinical experiences to her research. Her work focuses on combating multi-drug resistant pathogens, improving antibiotic stewardship, and enhancing sepsis diagnostics, all with forward-thinking lens in gender medicine and digital health. She is also the developer of a clinical decision support system for antibiotic therapy and strong advocate for gender equality in medical digitalization. So welcome to you, Irit, and thank you for being with us today. And last but not least, I want to introduce you to, I would say, a speaker with a great, unique perspective, Pieter van Galen. Pieter is active patient advocate and expert in cross-sector collaboration. Diagnosed with MS in 2006, Pieter has since become a passionate patient advocate and also a leader in the MS community. He's a long-standing supporter of the European Multiple Sclerosis Platform, EMSP, and also as an active contributor to the MS Data Alliance, a multi-stakeholder initiative committed to using data to improve care and accelerate research for people living with MS, and I would say also for other patients, because this work is not just always impacting patients with MS. As a freelance trainer and consultant, Pieter has worked with a broad range of stakeholders, from patient organizations also to the pharmaceutical industry, always champion the patient-centered, data-driven approach to innovation in care. He's also a proud author, and I know this because I was one of the other authors too, of the groundbreaking MS in the 21st Century publication. This was one of the first manuscripts written by patient advocates and HCPs. Over the years, Pieter has presented at numerous international conferences inspiring change and collaboration. Thank you for being with us today, Pieter. So, before we start, I want to give you a short overview about the purpose of the session and also about quantum. We want to explore how the EHDS, European Health Data Space, and GDPR, that lovely data rule thing, contribute to trust, privacy, fairness, and the use of health data and artificial intelligence. Discuss how legal frameworks can build trust while addressing bias, consent, and fairness. And engage in interactive sessions because your insights matter. Share your perspective through our live Menti polls so we can learn from you too. And in addition, if you have any questions, please let us know in the chat, because then we will have an eye on it and also can answer your needs. Next slide. So at first, we have 3 questions for you in the Menti. You can see it, the QR code. Please give us a short overview about the things you think to the questions. What concerns do you have about the use of AI, of your health data by AI? The second question is, how do you feel about the use of AI in healthcare? And how is your understanding of data protection laws? And maybe, Alpa, you can show us how the answers come in. Oh, that's me.
Yeah.
Okay, can we see the second question? And experts, please have a look at it, because maybe we come back to this afterwards. How do you feel about AI in healthcare and your understanding of data protection laws? Do you strongly disagree or maybe strongly agree? Okay. I feel comfortable with AI being used in health decisions. I understand how laws like GDPR or EHDS protect my data. Okay. We have a very informed audience today. Okay, can we see the next question?
Yes, of course.
Thank you. What helps to build trust in how health data is used? Transparency, okay. Patient control, that's interesting. I heard that many congresses and many sessions during the last weeks I attended to, that the control from patients and also citizens is one thing many people ask for. And I think this is something we should maybe a little bit more care about. I don't know. But at the moment, we have one of each points. Haha. Transparency. Rules. Privacy protection. Again, it's also very important. Independent oversight. Yes. Okay. Then we have a first impression, about our audience thinking. Maybe we can go back to the slides, and I want to give over to our great speaker first. Thank you very much. Ricard, it's your turn. I'm happy to have Professor Martinez in our session today. He will give us an overview about regulatories, legal sides, and also the different frameworks, and also, of course, the ethical side. Ricard, I would say the stage is yours, and I will come back maybe in about 10 minutes or so. Thank you very much.
Okay, thank you very much. I'm really grateful and honored to be here. And my apologies, because what you are looking in your screen is not my usual way for being here. I'm a professional and I have a good, let me say, premises at home, but now I'm in a summer course school at the university, and this is my room. Then, sorry, my apologies, but this is the best I could give to you today. And I'm connected with my own smartphone and crossing finger in order to be sure that you are hearing and seeing me. But let's go ahead. First of all, I'm sharing with you my experience on the building of the European infrastructure of cancer. We have been dealing with these problems because we have to build the infrastructure at the same time that from my collaboration with the Spanish Ministry of Health during the procedures of European Health Data Space Regulation and previous experiences working in the Spanish Data Protection Authority. Then I think I swear different hats and I have different approaches to that. First problem we are dealing with is that in this evolving situation, we have to cross, this is a cross-cutting of GDPR and European Health Data Space. It means that for building a solid infrastructure for sharing data, we have to consider the legitimation basis of Article 6 of GDPR and combining with the secondary uses or secondary legitimate purposes identified by the European Health Data Space, taking into account that one regulation is extremely dependent of the other. Let me underline that I'm not completely agree with that. I think we lost an opportunity. Why is it? Because if we consider European Health Data Space as lex specialis, would be more useful than considering this extremely dependence from both. But at the end of the day, in the side of data holders, we have to work really hard with hospitals and different data holders in order to be sure that they are reliable. It means that the first step, the first lesson learned is that, okay, you will be integrated in our infrastructure sharing data. And then we need first to meet your data protection officer that must be aware on that. And in practice, it's a mess because sometimes your counterpart is a researcher, it's not a data protection officer. And we need to know your legal representative. We need to be sure that you are, let me say, giving us evidence of legitimation for processing data, conditions for security, if you are integrated in our federated processing infrastructure, evidence on DPIA implementation if needed. Then at the end of the day, the first lesson learned is that to go beyond the European Health Data Space, you need to be really solid in GDPR. Without this pillar, you are in a hurry. And this is really relevant in our experience. On the other hand, there is a second issue that is really relevant for us. And this is a practical and a legal issue at the same time. Let me say, I'm trying to go so fast, then please, I will not talk about the definition of health data holder, health data user, data permits, and all of the different requirements that European Health Data Space has stated. But at the end of the day, let me say that we are building an European environment for processing preferably anonymized data. And instead of that, when the data access applicant or the data requester justifies the need of use pseudonymized data or the impossibility for anonymize them, we could use pseudonymized data on a secure environment. This puts anonymization in the middle for one side. And let me say, I'm not talking now about law, I'm talking about other value and reputation on the other side. Because what is stated is the opportunity for processing data with a consent exemption. But the balancing for the right of patients is called opting out. Then we are extremely sensitive for reputation issues. Because in my experience in Spain, you only need a public campaign against you for receiving 1,000 and 1,000 of opting out exercises. This is the reason for being really, really transparent in your condition of fulfilling the law and giving trust for patients and for society. But let me come back to anonymization. We are working in EUCAIM in building this strategy of anonymization. Let me show it to you. First of all, we are implementing 2 layers of anonymization regarding images. One is for direct identifiers, second regards metadata. On the other hand, we are working on how to anonymize medical records and medical information and how to integrate all with a hashing strategy for being sure that the integration of data sets is correct and it's clear and, let me say, reliable. On the other hand, we are trying to implement a software intermediation based on multi-party computation initially, in order to be sure that the user will have no opportunities of using data improperly or trying to identify. For us, this is a standard of anonymization, but not for data protection authorities. I recommend strongly you to read the allegation of the European Data Protection Supervisor in the your case and 2 paragraphs of the guidance European Data Protection Board on pseudonymization that has been submitted to public information. Because they consider that the anonymization must be irreversible independently of the context. For the European Court, it seems that if the user can re-identify, all is okay. For European data protection authorities, this is not the case. If anybody in any part of the world is capable for re-identify, then you are processing pseudonymized data. This will be a really huge problem because the European Health Data Space is based on anonymization and in the reuse of pseudonymized data under justification. On the other hand, Birgit, you have been talking about the, let me say, interplay between regulations. And we, in our healthcare area, will be working on high-risk artificial intelligence high-risk systems. And please read Article 10 of Artificial Intelligence Act on governance of data. they said, this is not only about fulfilling GDPR. This is about granting the quality of data, that there is enough amount of data in order to be sure that explainability, affordability, let me say reproducibility, and exclusion of bias is granted. Then it means that your data set must be a clear quality data set, and the volume, amount of data, and diversity of data must be granted. Then, if you are applying the standards of anonymization of European Data Protection Board, probably your data are not enough good for fulfilling the standard of AI Act. And this is a problem that we have to balance. For this reason, I want to underline that anonymization is in the middle of our main concerns. On the other hand, and related with that, the concept of secure processing environment is really nuclear here. And how to guarantee that? No references are in Data Governance Act or in European Health Data Space. They only define goals, aims to be fulfilled. But let me say, this is a really basic for an expert on security. They are not talking about ISO 27001 family. They are not talking about national standards. But this is an additional nuclear issue for being successful in the European Health Data Space. Your data space must be a really and real secure processing environment. I recommend to you the reading of the guidance of the Spanish Data Protection Agency on the European data spaces related with GDPR and the work that has been begun by INISA in this area, because they are giving us insights about how to develop this European health data space in order to be a securized environment. And finally, AI and ethics. Give me the opportunity about not to talk about the traditional layer of ethics, except for one reason. European member states are capable, have the power for regulating ethical conditions. It means that we have to deal with the different requirements of every state in this area. But at the end of the day, I think the most important concerns will regard the AI ethics. Now, we are playing with the so-called Altai model provided by the high-level expert groups on artificial intelligence. We are trying to apply this model in the UCAIM strategy. But I think that we will need to learn a lot. First of all, because part of these ethical principles has been regulated on GDPR or on AI Act, then they are not only ethical principles, they are, let me say, legislative requirements, exclusion of bias, non-discrimination, privacy concerns. But on the other side, the Altai model is based in a list of control. Let me say, I usually work with a risk analysis based on the relationship between equal check controls has more difficulties to be understood and to be applied because you have no metrics. You only have a general approach about each principle and how to deal with. Then, and I finish with that, remember the main points I want to underline. Conditions, previous conditions from data holders, you could add data users, anonymization, requirements of your environment, and finally, the new AI ethics layer. Many thanks, and let me say my apologies because the quality of image and let me say the back is not the best.
Thank you very much. This was a great ride. A bit like a roller coaster because it was a lot, but it was really interesting and it gave us, I think, new inspiration, thoughts, and also food for thoughts, maybe for Quantum, what is also working with the use of secondary health data and also finding out how to certify health data, for the secondary use of health data. We have a new mentee now, just as you have listened. Oops. We have 2 questions to you, and maybe Alpa, you're in place now again, and then we can see how people think now. Meanwhile, when you have questions, please let us know in the chat. As Barthélemy also wrote, if you have questions, please let us know. Write it down in the chat and we will bring it into the discussion. But before we start, what helps if data is used? Trust is one of the biggest words, I guess, we have in this world at the moment existing. I hear it on every corner. And it's not so easy to generate trust. And the second question is, with which ethical dilemma around health data and AI concerns you the most? So let's start with question 1. Okay. Experts, we have lots of transparency here. We have privacy protections, then independent oversight, patient control, and consent rules. Consent rules is just one. I think the mentee will be saved already, Alpa. So if people want to share something, maybe after the session, we can have a look at it and also bring it on to make sure that people see what was most important and what not. Okay, again, can we go please to the second question? Just answering to Ms. Murray, no problems. We will share definitely the recording, and if you have any questions, please let us know. Afterwards too, we have a website and an email, so you can find us. So which ethical dilemma around health data and AI concerns you the most? Accountability. Bias. Bias is an important theme. Also, as a person living with multiple sclerosis myself, sometimes I have also these bias questions in my head when it comes to AI. And also as a woman, it's not always easy in that role. Transparency, yes. We have 14 from 24 on 15. 16. We're growing. Anyone else wants to say something about that? Okay. Lots of thumbs up. Okay. So I would say thank you for that. Let's start with our discussion. So we know a little bit more. We have heard Ricard Martinez about the ethical and also the I would say the frameworks, the GDPR side. What do you think about the answers?
I think that they are the expected and the usual answers, for sure. Okay. Because I think all of us are experts or persons related with this area, and in that sense, I think that they are in my expectations. In any case, I think I need to underline that they give us insights about where we have to work. At the end of the day, let me only underline one of the slides. Consent is not here. because we are assuming that in future we will process data on AI based on anonymization, based on the let me say the powers that European Health Data Space is conferring to us. But it means that on the other side, transparency, exclusion of bias, and AI principles will be really relevant here in order to provide to the society, let me say, the absolutely trustworthy on what we are doing with data.
Mm-hmm. What do the others think? Irit, you nodded before, I saw that. Do you have any thoughts on that, opinions?
In what sense? Let me say that I have more than opinion. I have an opinion about how to work with that as a lawyer. And for me, it's really relevant. I think from other colleagues, it will be the same. In my area, and with a lot of colleagues, there is, let me say, some kind of formal approach to these problems. And the balancing and the way for implementing laws is so traditional. What I learned in the last years is that I'm working with developers, I'm working with scientists, I'm working in the strategy of data protection by design, legal compliance by design, and it means that I must be working together, understanding technology, and looking for different roadmaps in order to make feasible what we are trying to do. And let me say, this is a really hard effort. Then in my case, lesson learned regard how to work in this area.
Okay, let's hear the scientist, Irit.
Yeah, to me, we need more doctors to work with data and to become better, because transparency and bias are those things that people fear the most, and especially bias if you don't have doctors who work with it. And if you look at all those meetings, whatever, there are rarely any doctors. And if I talk to doctors, they are not very much aware of biases in data, quality of data, and those are the people that should work later on with the data. So we need more scientists from doctoral sides, to me.
Okay, Pieter, what do you think?
Well, I think I agree with what both previous speakers said, Ricard and Irit, but I really think it depends on which hat you put on. So if I put my hat as a patient expert on now, to me, bias would be very high up there, and also privacy, data security wise, because it could have an impact that people really feel if they think, oh, my data will be breached soon. I will not be able to get a loan anymore because they know about my disease. They will sell my data for marketing issues, for instance. So people are really scared about these things. On the other hand, what also patients do, that I notice, is as soon as they come back from the doctor and they get their MRI in their hands, they post it on Facebook and ask everybody in the world. So it really depends on, we have a very a group here that is very knowledgeable about these things, but people hear things on the news, they read it online, they do social media, and they are all of a sudden, like, by journalists completely going one way and the other way, but they don't realize what they're doing with their own data sometimes. So I think it's very interesting to ask, put your top two, but I think it's important to really think, okay, who are you asking and who is the person answering behind these things? Trust is something that is also on the second or third on my top 3 list, because trust is very important. If I go to the doctor, I want to have a trust relationship with him or her, because otherwise empathy is something I completely lack by just looking at data. And therefore I think that human trust is also one that we could maybe add into the equation. Do people trust the data? Okay, it's anonymized, but I think many patients don't know what the data can do for them in the long run, or what people can do with their data combined with others. So it becomes big data. I think I'll stop there. You probably have another question coming up.
I have a question. regarding what you've said, Pieter, and I had to laugh because I always see that. So MRIs on WhatsApp, MRIs on Facebook. Hey, this is great. We want to have that. Not. But I have a question to Ricard, because as we said, many people worry about who sees their health data and also how it's used for from a legal point of view. What protections are already in place to keep our data safe, and what should people know about their rights are protected also under GDPR and the EHDS, because we have those patients' rights, but I can see also that not many patients are informed, or also not many citizens are informed, as we are talking always in Quantum, not just about the patients, also about the citizens. And I think sometimes a citizen can be a patient. Guess what? It's a big surprise, but it can happen. And then they start to think about it. But do we have anything in place to give them maybe a bit of information and also how it is protected?
Yeah, let me say that what GDPR makes possible usually is in the back end. It's in the back stage. It's not seen by patients. What is really relevant here is the risk analysis, the data protection by design principle implementation, the managing of data, the security of data, the quality of data, and at the end of the day, this must be transparent for patients. They must be informed about how the data are processed. They have been, convinced about the security, and you are right. My last colleague is really right. This is not only about GDPR. This is about common good. This is about the purposes of the use of data, because we need to engage these patients. Patients are worried about their privacy while sharing data in Facebook, because let me say, there is a mistake in about how conceive that. They are worried by news, they are worried about data breaches, and now we have to say to them, okay, we will use your data for common good in a secure context and being transparent about what we are doing with your data. And you're completely right. Let me say that this is a stupid issue, but I'm a blood donor. I received the same letter the last 50 times. Mr. Martinez, your analytics is good. We are really happy to have you on board. With your blood, we have helped 10 persons in order to blah, blah, blah. Same letter every donation, and same happiness. This is about engaged patients. This is not only about a formal conception of law. And in my view, technology and security are really relevant here for giving this confidence, for giving this reliability on what we are doing.
Okay, thank you very much. That's great insights, and especially with Data Saves Lives Germany, we work also on communicating and information to patients and citizens to make sure that they understand what's going on. But it's a hard thing because it's a challenge to understand what's going on and also what's behind the European health data space. What can I do with it? And why do they need maybe want to do a secondary use of my data for the common good? Maybe it's also about data solidarity. But Irit, I have a question for you. When we talk about labeling, data labeling, would that be helpful from your clinical experience to have that clear label in place, showing also that the data set is a good, trustworthy one, and also that it's accurate and complete? So as Ricard said before, it must be very transparent, it must be very concrete and accurate and exact, also to make sure that the use is working in a good way, let me say it in that way. Do you think that it could maybe help for doctors to sell things a bit better? And also, would it help in the same time to reduce errors or tailor treatments better?
Yeah, I'm working with data now for a long time, and in the beginning, long time before we had, the big data and whatever, I produced the data myself. I put, we had paperworks and we put it in computers and, put it all together. So I knew every data and I knew how good or bad they were. And by now I'm working a lot with big data, and you see sometimes, or maybe let's say often, data that I don't really trust in. So I don't have a good feeling to make my research, to base my research on data I can't really trust. And I'm working on gender bias, and if I have so much less data from women, what we have in infectious diseases, we have 1/3 less data of women in infectious diseases diagnostics. I don't trust the data anymore that we can give the same recommendations for men and women if we have so much less data. So I really would love to have the label, who took the data, where they're from, how made them, who put them in there, and what was the reason they were put in there. Because I'm working with data for Abrechnungsdaten, whatever that is in English, data that are made for other things, and they are not good for research. We know that, but still we don't have anything better. So we need it, but we need to know what's wrong with them, how to deal with it, how to deal with confounders, with bias, that money matters for those data. So yeah, if we have a label, but it needs different labels for different questions.
That's interesting, because we can say one label is not enough in that way. So yeah, I agree. And especially for women's data, it's always a big problem, as we don't have many at the moment, and it's always too less to find solutions. Pieter, what do you think? Would it help to be better informed to those Facebook sharing patients to know more about it? Or do you have a different opinion?
No, completely. I agree with the fact that people should be informed. And I even think from an early age on, let's say on school, because if kids get involved and maybe interested in data, excuse me, then it could be a lot easier for them to convince when they become adults, and to automatically share their information. They will know, okay, info is out there, whatever I do. I have the same with my kids now, that I say, okay, you have to really share your data. And they're young still, 13 and 15, so I start early. And they don't even know how and what, but if they already know the blood type, for instance, that could help. And it's useful to share, because if you have an accident, it's best to tell the ambulance that you know your health, your blood type, so they don't give you the wrong blood or anything. So I think it's important for anybody, the public in general, because people can become patients at any point in time, that they are informed about what data can do for them in the long run. And I really enjoyed and liked Ricard's example about thanking people for giving blood. So also give feedback to the patients, what is done with their blood or their data. So it could either be a simple thing like, okay, we've helped so many patients, so many new research has been done based on, obviously you're only a part of the data, yeah, but the little parts create a big momentum. Now, does that help, Birgit?
Yeah. So
Yeah.
you're one of the good ones, because I know a lot of parents, but sometimes it's a bit hard for them to explain their kids.
Yeah.
This
Well,
health data
I'm not saying if I understand everything immediately, but it's a continuous improvement, and also it needs to be told by both the educators in school and supported by parents, let's say.
Okay, yeah. This is going into a health literacy thing also,
kind of, yeah,
because I think health data sharing belongs to health literacy in general, because we have to know more about it also when it comes to health data labeling and the secondary use of health data regarding the EHDS. I have to ask you, Pieter, is there
Yeah.
enough done for protection and keeping legal and ethical aspects in mind in health data regarding patients, or do you think there must be done more?
Always, more is always possible. I mean, hackers will always find ways in and out. But we can only do as much as we can. I think the legal side, GDPR and other issues or other standards that have been set up are great. People need to know about these things and have trust. I think the majority, 99.9 etc% maybe, doesn't want to do bad things with data. Unfortunately, if one of or 0.001% does, we hear about it and everybody is enraged and is scared. But that's really a minority. So I think we're on the good track to do. GDPR works really well in Europe, or works. I mean, we've had a long, difficult way since 20, when did it start? 16, I guess? Or I know 25th of May, because that's my brother's birthday, the first GDPR opening. But yeah, we can always do more. But I think information is key, and education. I've spoken to many doctors just being students and in medical school, and they don't know about these things. I mean, they're obviously busy with their patients or trying to learn about whatever they learn about in medical school, but data is becoming a very important item also for them in their research, in their careers. So it should be an extra module in their education.
I can see Irit nodding.
Yeah, I can also see people that are really good. Thanks.
So true, because they don't learn it in university. If you talk to them about statistics, about data, they don't learn anything. And especially for statistics, it's very old schedule they have. It's, you know, from the times when we took our data ourselves. They are not taught what to do with big data. They are not taught to trust these data or that data. They are not taught to use them and to build their own opinion about this kind of data. So we need for many things to rebuild the curriculum for medical students, not only for data, for nearly everything, because they learn a lot of things. They have to, you know, they don't need anymore, but they don't learn the things they need in future.
Yeah, completely agree with that, because that's what I noticed about university students, but also elementary school. My kids are just out of elementary school. They learn so many things and they tell me, why do we have to learn this, Papa? Yeah, and I really, like, oh, I don't know. Do you use it every day? No. And the only thing that I can tell them now is brain exercise. But I don't know what else to tell them. Learn these things by heart.
Absolutely right. It's the same for mine. The one just finished school, and we decided now learning starts, because it was a lot of stupid things she had to learn in school. Or not stupid, just useless for normal life.
Sometimes it's useless. I agree totally. Ricard, I have a question for you. When we're talking about, so we have talked a lot about patients, means citizens living with chronic or long-term diseases. What do you think? Do we need more also information about for the citizens outside who are not currently ill, and how can we involve the wider public in shaping how health data is used, and how can the EHDS and also all that artificial intelligence and ethical stuff to make sure that they know their rights and expectations and values are taken seriously? Because sometimes I hear I don't feel very confident, because I think I'm not taken seriously also. So as one of the heroes and experts working on the frameworks, do you have any advice for us, and especially also for the patient and citizen communication group here we have at the Quantum project? How can we maybe make sure, or how do you have an advice for us? How can we reach them out a little bit better? Maybe, I don't know.
I think I will have information for you in 1 year, because we compromise an experiment on consent.
Okay.
But I have so many prejudices on that. And this morning, here I heard that in the community of Cantabria, they have made an experiment using the interaction of AI and video, and have recruited 50,000 people for donating data in this area. Because at the end of the day, one of the most, let me say, if you are a patient and you are in front of your doctor, your physician, and he or she asks you for data, let me say, you will give him or her data and all of your possessions because you want to be recovered. Then this is not the case. The case is how to convince the population, and we are talking about non-patients, because all of data are relevant. And I think that Irit will have more information than me, but at the end of the day, to use data from everybody and to consider the long-term studies and the long-term analysis of data will be really relevant, not only in past, but every day in future. What we will try to experiment in our project is to, let me say, use new approaches to that. Okay, not only about, okay, here you have 15 pages about information on our experiment, legal ones, ethical one, data protection one, and we try to experiment with, let me say, I don't want to say a TikTok experience, but we're talking about video, less informal in terms of communication ways. We have to work for them, not only for the lawyers, not only for the formal compliance. It should be done, but we have to look for new ways for communicating the things. On the other side, and this is a real experience, in my projects, I try, let me say, with no success, to be directly connected with the dissemination and communication team. Because sometimes the problem, the worries of population comes from a, let me say, in a wrong way to communicate what we are doing. And if we communicate to population that we will process 1 million of patient records without no additional information, with no transparency, with the only message that, okay, we will be processing your data, we are at risk. We have to consider all of our strategies in communication in order to provide, let me say, clear, transparent, and trustworthy information for population.
Okay. This was, unfortunately, as we are going very close to our timeline, the last very clever comment. Thank you so much to you all. It was a great pleasure to have you in this chat today, in this discussion, and I'm happy that we had some more to do this, and I'm really grateful for your insights. I think we have learned a lot also for Quantum, and also as it is EU funded, also to give some new inspiration and insights into the project and also in our working groups. I really appreciate that. Before we leave, I have some short announcements. But just for the case that you have to leave, Irit and Ricard, thank you so much for this. Thank you for being part of that discussion, and please share and also come back if you can, and if possible. Also to you, Pieter, it was a great honor to have you also on board as an engaged patient advocate, so really appreciate it. So I have questions for you. We have another Menti, and we don't want to show the Menti now because it's for our fourth session, what we will drive by the end of summer. So now we are going into a summer break, and we have 3 themes to you, what you can choose. First theme is innovation, AI, and health data. too fast, or is this the momentum for better data and care? Benefits, changes in healthcare or the system. How can health data labeling works with AI to support doctors and give benefits to patients and their care? Theme 1, news around the European health data space. How does it move forward, and how will health data labeling connect with the EHDS? This is theme number 2. And the third idea what we had is health data and personalized medicine, and how can health data labeling help? More focused on patients maybe, and also carers, and such as gender-orientated data, shared decision-making, etc. So there is a lot in it. You have a voting, and the voting is open till July 18th, end of day. Use the QR code. Give us an idea what we will do, or what we have to do. What theme is most important for you? We will announce the session date during the next weeks. At the moment, we are trying to find a date in September, but I'm optimistic that we will find one. And so give us maybe your choice and let us know what you want to have next in one of our online sessions. As I said, you have the 3 themes. The Menti is running already, I guess. If not, you can read it, and also we will share news and announcement about the progress of the themes during the next weeks. Okay, then I would say we got it. Do we have any slides? Do you have any other questions? The chat was a bit quiet today. I think there is, yeah, Alison Johnson said, storytelling filmmaking is a powerful way of educating the public. Thank you, well noted. I will bring it back to the consortium. Maybe we will find someone who is giving us the opportunity to make some videos. Also, the team will note that. If you want to get involved, we have a website. You can see the QR codes, you can subscribe to the newsletter, and also you can join our network. Social media communication, also communication via our website, and also the channels will be of I think Bartholomew is sending it out always. So if you register for that, you can also receive the latest news, and also, I would say, the little reminders for choosing a theme for September or October. So I think we are in time. It's 3 o'clock now. Do we have any slides, Regina? Yeah, it's on my way to say thank you. Thank you that you are with us today. Thank you again to our great experts and the panel, and thank you also to you all to be part of it. If you are not registered, come back to us and be part of the network.